Hey everybody, good afternoon. Welcome back to our second session of the day. Happy Friday to all of you. Thank you for your participation this week in the virtual payer forum. I hope it's been worthwhile. The last session of the week, we've saved the best till last, right, Mariano?
Absolutely, thank you.
The last session of the week is with our good friends from Humana. We have not been able to coordinate our schedules the last couple times we've had a forum, but Mariano is with us today. Mariano Lopez Mateos is the Director of Provider Contracting, and he has been kind enough to work with me over the last couple of weeks to coordinate this presentation for today, and we're delighted to have him. And just want to give everybody, we got to still have some people logging in and signing on, and so we'll give it just a couple minutes here and then we'll get started. Just a couple reminders, whether you're watching this on your computer or just listening to it on your phone, there is a section for Q&A. If you have some questions during the presentation, feel free to post those questions and I will share those with Mariano as he's going through the presentation, and we'll try to get you answers to those. If for some reason we need to follow up and connect the two of you, we can certainly do that. The presentations will be shared with the attendees. I'm working on doing that here before the day is out. And we also will have the Georgia chapter YouTube page. We'll have the events posted as well. So appreciate everybody's support and participation. It looks like we're holding steady with the number of attendees right now, Mariano. I'm going to go ahead and turn it over to you if that's okay. And again, thanks so much for being here.
Absolutely. And Bill, thank you for extending the meeting invite. Definitely, I understand to your point, Humana has not presented in the last few years, so I greatly appreciate being a part of this forum. So as Bill mentioned, my name is Mariano Lopez Mateos, and I'm one of the contracting directors for the state of Georgia. I have a team of contractors and administrators, and we help support our provider network across all lines of business, MA and commercial, as well as all provider types, excluding behavioral health. A little background on myself: I've been with Humana since 2006, and I've worked in various contracting roles, transitioned then to Network Relations Director. I spent about 4 years in provider engagement, and finally transitioned into my current role a couple of years ago. So I understand, again, we've not been an active participant to Georgia hfma. Not sure if I love the fact that I'm probably between you and the start of a weekend, but here we are, and hopefully you find the presentation material helpful. I'm also joined by Chris Gentry. He's our Senior Provider Improvement Professional, and he's here in support for our Q&A session, but also if any questions should arise during the presentation, he's more than adept at helping answer, because he's a subject matter expert in several areas. So Chris Gentry, thank you for for attending and being here in support. So this is our agenda. We're going to talk about Humana's purpose. We're going to review Bold Goal. I'm not sure how many of you are familiar with Humana's Bold Goal initiative. We're going to review Humana's market presence in the state of Georgia. We're going to cover some web resources, humana.com and Invalid specifically. We're going to review processes around pre-authorizations and claims, and we're going to close it out by sharing some insights around value-based care, Humana's programs that really kind of helps align incentives to driving outcomes for Medicare Advantage members. So what's Humana's purpose? It's our members' health. Since 1961, Humana has been committed to helping people live healthy and happy. I'm not sure how many of you know that Humana was initially founded as a nursing home company. We then transitioned to acquiring hospitals, at one point becoming the world's largest hospital company in the 80s. So caring for others is in our DNA. And we want to offer our members personalized care from people who care. And we do this by listening to our members and creating solutions to help them receive the best version of themselves. We're also deeply invested in towns and cities across the country, and we strive to support and improve communities at a local level. So we'll see an example of this next. So Humana's bold goal aims to build a sustainable system by working with our partners to help connect those in need to resources within communities. Humana has deployed bold goal initiatives throughout 19 markets nationwide, Atlanta being one of them. And I'd like to share some of the highlights from Humana's 2021 Bold Goal Progress Report, which was recently released. The report reflects the impact Humana is having on the lives of our Medicare Advantage members through our Bold Goal initiatives. So Humana measures the health-related quality of life of members through the CDC and Prevention's Healthy Days survey, in which members self-report both their physical and mental health-related quality of life over the previous 30 days. For 2020, results show that MA members maintain overall health despite the pandemic, with a reduction in physically unhealthy days. And when we compare Humana Bold Goal markets to other non-Bold Goal markets, members experience approximately 3% fewer unhealthy days, with the largest impact among those that are most vulnerable, members enrolled in low-income subsidy plans or LIS plans. A key component to impacting the overall health of our members is identifying food insecurity. So in 2020, Humana performed over 6 million screenings for social needs and made a direct impact on food insecurity by providing more than 1.1 million meals to at-risk members. So the landscape in Georgia, we have approximately 387,000 individuals that are enrolled in a Humana plan. An additional 283,000 are enrolled in a specialty plan, i.e. dental or vision. And our members are supported by a network of over 43,000 PCPs and specialists and 153 hospitals across the state. Humana is the largest individual MA payer in Georgia with over 38% market share, and we've captured 60% of the market growth from 2018 to 2021. So how has Humana become #1 in MA in Georgia? Our unique benefit designs and diverse plan offerings not only provide benefits for medical care, we also include benefits to support members where they live, addressing the members' social determinants of health, including aid in transportation and help with food insecurity. In 2020, Humana leveraged the Medicare VBID model to offer the healthy food card benefit to qualifying members in several states. This benefit can be used to purchase healthy groceries at various national retailers, and it comes in the form of a wallet card loaded each month with funds. This holistic approach will play a critical role in comprehensive treatment inside as well as outside the walls of the provider's office. Our members' health is in the hands of our network providers, and that's why Humana is committed to supporting their practice with training resources, policy updates, and industry-leading patient care programs. If you go to humana.com/provider, you'll find that the webpage is broken down into 4 sections. And I've actually included here, these are direct screenshots from the humana.com/provider website. So the first section is a common task section, which contains links to authorizations and referrals, availability login, drug lists, reconsideration and appeals, COVID resources, telehealth, and virtual care. Second is the claims training and notification section, which contains claims processing updates, coding guidelines, tutorials for working with Humana, a quarterly newsletter, and Humana's 2021 value-based care report, which we just reviewed. The third section contains patient care resources with a focus on health and quality initiatives. And the fourth section contains helpful resources such as how to join Humana's network, Availability Essentials portal link, and provider guides. And we'll go into some of those in more detail. So this is a snapshot of Humana Physician Use, and I'd highly encourage you all to subscribe. It's a quarterly newsletter for in-network physicians, clinicians, and office staff to support you in the care of your Humana-covered patients. So as an example, in the latest newsletter from Q1 of 2022, Humana provides a resource to help your patients stay on track with their WellCare visits and screenings by sending annual preventive care reminders. Humana's Provider Marketing Resource Center is a self-service marketing storefront that enables you to quickly and easily customize marketing templates with your practice information and send communications directly to your patients, regardless of their insurance carrier. Most importantly, the resource is available to you at no cost. I'd also like to share with you a couple of printable resource guides that can also be accessed via humana.com. The first is labeled Tools and Resources, and this is a 9-page PDF document that can be downloaded and saved by going to humana.com/making it easier. It provides an inventory of commonly used self-service tools and resources Humana created to make it easier for you to find the information you need. The information is categorized by function to guide you more directly to what you need. The link also contains a 9-minute, 49-second video that walks you through each topic listed on the table of contents. The second printable resource guide is a resource sheet for healthcare providers. So this resource sheet contains links, phone numbers, and general guidance on checking patients' coverage, link to Humana's PAL list, steps for submitting pre-authorizations, pharmacy or medication pre-auths, how to submit a claim, how to check claim payment status, how to submit a claim appeal or dispute, how to manage overpayments, and training and education links. So Humana requires pre-authorization for certain services to facilitate care coordination and maximize benefits for your patients. You can find the most current and up-to-date prior authorization list or PAL list on humana.com/provider under the common task section, as we just reviewed a couple slides ago. A pre-auth can be requested either online via availi.com or by phone by calling Humana's IVR line at the 800 number listed here in the middle of the slide. We strongly encourage providers to leverage availi.com for the submission and management of prior auth requests. Here you can modify prior auths, check their status, and view 18 months of historical prior auths. We'll go into Availi in a couple more slides, and most of you are probably familiar with it. If you're not, it's a great resource. It's payer agnostic, and you can manage authorizations across multiple payers through one site. So for prior auths related to drugs, forms can be obtained via humana.com/medpa or by calling 866-461-7273. If a provider is administering drugs in their office, a clinic, outpatient, or home setting, they can go to humana.com/medpa and send a fax to 888-447-3430. So there are two ways to submit a claim to Humana. First is electronic claim submission, and the other is paper claim. Valid NPIs are required on an electronic claim submission and strongly encouraged on a paper claim submission. If a paper claim does not have all necessary NPIs, it may be denied or subject to delays in adjudication. Healthcare professionals and facilities can use the Availi portal and EDI services as no-cost solutions for submitting claims electronically. To register for the Availi portal or to learn more about Availi claim solutions, you can visit availi.com. Healthcare providers also may file a claim by EDI through the clearinghouse of their choice. Some clearinghouses and vendors charge a service fee. You can contact the clearinghouse for more information. Also, if you're submitting a claim to a clearinghouse, you should use Humana payer IDs 61101 for claims or 61102 for encounters. And some general timeframes for claim submission for Medicare Advantage claims, they must be submitted within 1 year from the date of service or as stipulated in the provider agreement. For commercial, claims must be submitted within 90 days from the date of service if no other state mandated or contractual definition applies. Also, if a claim is submitted in error to a carrier or agency other than Humana, the timely filing period begins on the date the provider was notified of the error by the other carrier or agency. So to inquire about a claim, you should call the phone number on the back of the member's ID card. A Humana provider service rep will log your call and provide you with a reference number. If your issue is not resolved during the call, the provider service rep will create a task into a shared enterprise tool similar to Salesforce, which routes to a specific department for further investigation and resolution. You'll receive an email confirming receipt of the issue, as well as regular updates to inform you of the status of the inquiry. If you're not satisfied with the final resolution of your inquiry, you can escalate the inquiry by emailing Humana Provider Services at humana.com. Include the reference number and the additional information listed below under step 2, A through F. Electronic claims payments, they offer several advantages over traditional paper checks. For example, electronic claims payment can help with faster payment processing, reduced manual processes, access to online or electronic remittance information, and reduced risk of lost or stolen checks. With EFTE, Humana deposits your claim payments directly into the bank account or accounts of your choice, and will also enroll you for our ERA, which replaces the paper version of the EOR. Physicians and or healthcare providers can use Humana's ERA EFT enrollment tool on the Availity portal to request enrollment or update an existing enrollment. So these are some key metrics that we look at related to claim payment time cycle and the volume of calls being received. Both of these metrics are for a 2-year time period and specific to Georgia-based providers. As you can see here, the left graph reflects the fact that 92% of clean claims are processed within 14 days. Also, this is astonishing when I saw this number, Humana's call center received almost over 500,000 provider calls for this 2-year time period, and 3 out of every 4 calls were related to claim status and benefits. And as we just talked about, we highly encourage the use of Availity to check claim status as well as check member benefits. So with Availity, providers can conduct business online quickly and easily. We've been talking about the functionality of Humana.com, and it's great from the perspective of staying up to date with how to best work with Humana, due to the fact that it contains claims policy information, provider manuals, PAL lists, etc. However, Availity is used for more of the day-to-day office business functions, such as checking eligibility, co-pays, deductibles, checking claim status, etc. So again, Humana strongly encourages provider administrators to use the Availity Essentials portal to do a lot of the things we just mentioned, in addition to submitting medical records, managing overpayments, signing up for electronic remittance. You can find Humana-specific apps, resources, and news as well. And the benefit, as mentioned before, it's payer agnostic. You only need one user ID and password to work with Humana and a number of other payers. Availity can also help you structure unique payment or reporting methods depending on the needs of your practice. Availity integrates patient payments right into the Essentials workflows and includes cost-efficient payment processing. You can swipe a card or set up recurring payments to help spread the patient's cost out over time. So at this point, you're probably seeing a theme that centers around technology and the migration from paper to more electronic automated solutions. Signing up for ERA EFT is easy, and you can do so via Availity.com.
It really has been a common theme this week, Mariano. The move to digital and online portals and stuff, that really has been a consistent theme. And so, from the provider's perspective, just the ease of use and the consistency of availability and whatnot should make things a little bit easier, would be the hope.
Absolutely. Couldn't agree more. So transitioning to value-based care. So value-based care is a central strategy to improve quality and health outcomes while managing costs. Misalignment between providers and payers creates enormous waste in the healthcare system, but by working together, payers and providers can reduce administrative complexity and combine data sources to better understand patients' health needs. Through partnership with providers, we can scale the best evidence about clinical delivery models that have been shown to improve outcomes and reduce costs. As value-based care continues to gather momentum in the marketplace, we aspire to engage all providers in partnerships that align our interests with each other, and most importantly, with the needs of our members, your patients. Humana covered patients are benefiting from value-based care's preventive, holistic approach. PCPs influence so many areas of health by determining which specialists achieve the best outcomes and referring patients to them, by focusing on educating patients about personal health, or by prescribing needed medications. Patients likewise have tremendous influence on their own health, such as deciding to participate in programs, changing their daily habits, or welcoming home-based services. They're the ones ultimately choosing to stay with both of us, provider and payer, based upon the experience of the care they receive. As a health plan, we're able to influence a number of areas aimed at helping patients achieve their best health. We develop analytics and insights that help physicians identify care opportunities, trends in disease prevalence, outcomes, and costs. We also can help with chronic condition management, education, fitness programs, mail order pharmacy, affordable premiums, and predictable medical costs. Almost 2/3 of our MA members are aligned to providers under a value-based arrangement. And this is important to Humana, and we continue to work to increase this percentage due to the fact that we have proven data that shows that our value-based members aligned to value-based providers receive more preventive screenings, have fewer hospital admissions, and drive lower medical costs, which in turn allows Humana to further enrich member benefits. And we have a number of value-based programs available to PCPs and specialists that are designed to meet providers wherever they're at along the value-based continuum and support the progression to full risk if they so choose. Each value-based program from left to right builds upon itself, first offering incentive dollars for achieving quality and clinical measures, and then maturing to offer upside-only shared savings based on the financial performance and management of parts A, B, and D, expenses and revenues, and finally to global risk. And this concludes my presentation, and I'd like to now open it up for any questions the audience may have.
All right, thank you, Mariano. That was very, very thorough and complete. I appreciate that. Want to see if anybody's got any questions for Mariano. As we've been saying all week, you know, the tools, the resources are certainly there and available for you. Let us know, speak up as it relates to the challenges or the issues with that you might be having on when you're doing claims follow-up, on the process in general, anything that Mariano can take away from the presentation that might help the process going forward. We'll give you just a couple minutes to think about that or respond to that or type in your questions or comments. It would be greatly appreciated. Anything we can do to improve the process is what we want to try to get out of these sessions. So go ahead. Mariano, is there anything that that comes to mind? Maybe you've already addressed it. Anything that you or Chris would say comes to mind as provider issues that come up from more frequently than others? Anything that you're seeing that providers maybe are doing that they need to adjust or change or do differently? Anything in particular come to mind that you haven't already covered today?
I'll let, I know Chris helps support, you know, several markets, and I'm not sure if anything comes to mind, Chris, that you may be seeing any suggestions to, you know, you know, folks that, you know, are in the day-to-day of submitting claims, anything that you're seeing out there?
Can you hear me? Okay.
Yep.
Yes.
Yep.
Okay. All right. Perfect. Wasn't sure. Not really, Mariano, because I see so much of everything. I can't really target anything in specifically that I see as a trend. I just cover such a wide area of different types of issues that I really couldn't identify something in particular.
Okay.
So your recommendation, Chris, I mean, aside from, you know, leveraging the online resources, it's, you know, the calls into to Humana, the reference numbers, the you know, following the claims escalation process. I know in some cases we have, you know, these SOC calls, you know, for key provider groups to talk about escalated issues. I mean, there's a lot of ways to kind of interact with Humana. Ideally, we'd like to, minimize the number of issues going on, but I think it's, the level of transparency between Humana and the provider to ensure that we have, up-to-date information. Provider rosters are being received regularly, so we know who's in network and who's not. There's a lot of consolidation going on in the market, so just making sure that, again, kind of information is exchanged in a timely manner, and we can make those updates in our system to then, limit or reduce the claims issues, down the road. I think that, from my perspective, that's something I think we could all do a better job with, is just the regular exchange of information as it relates to kind of just provider loads.
Sure. Here's a couple of questions that popped up. One attendee says that they've encountered some claim line denials for invalid modifiers on Medicare Advantage plans for some medications. Does Humana follow all of the regular route of administration modifiers that are required by Medicare?
Yes, and the answer to that question would be yes. So whenever we're denying a claim for use of modifier, it's generally because we don't expect to see that modifier ascribed to that service. I know Mariano pointed out earlier, there are some opportunities for you users to go out on our website. We have a number of different computer-based education sessions that talk about modifiers and kind of our position on how we expect those to be used. We also have an online tool that allows a user to go in and actually put in what we would call a kind of a test claim, or even a real claim in which the modifier is in question, and it runs it through our edits. And if the modifier is the issue, it will actually give you a very in-depth description of why that modifier is not expected to be used on there. And we do look at, and we also do look at things like if you are challenging that and you give us information and to support why you feel that that modifier is valid, we will look at that to see if perhaps that's something we need to look at a little bit more in depth. But the quick question answer to that is yes, we align our systems with how we expect those modifiers to be built.
Okay. Another question, and I think this is, I've found this to be a hot topic across the board, and not just with any one particular payer. It sort of continues to be an issue for everybody. How long have we been talking about denials, right? And you'd think we'd be able to get them figured out by now. But if a denial trend is identified and no resolution has been accomplished with the provider rep, what is the next level? How would you recommend the provider escalate that issue?
Well, that's a great question. And Mariano alluded to this in the presentation itself. We actually have a process document along with a copy of the PCU escalation sheet. That's where, he was talking about the escalation process that directs a provider exactly how to go about disputing a claim. If that's something that you have some providers that are not aware of or don't have a copy of, they can circle back with the contractor. The contractor will actually furnish them a copy of that. And it's very well written. It walks you right through. Call customer service first, see if you can get it resolved. If you can't, here's your next escalation process, which is that PCU escalation avenue, along with the spreadsheet that we ask you to fill out for us. In the presentation, Mariano had listed those items that we need to make sure are included. You don't have to worry about remembering those because the spreadsheet has them on there. And it actually tells you where to send that. And then that rep will work directly with the submitter until such time as resolution is obtained. And if we still are in an impasse, that's where I would kind of come into play to say, okay, why are we not getting resolution to that? Why are we not getting agreement? So that's kind of where I would come in to see, did we go far enough with something? Do we need to take it a little bit farther? Is it just something we need to educate the provider on to get closure to it? That's the ultimate objective, is to get some closure to this.
Right. Okay. All right. Hopefully that answers that question. Very good. Very good. All right. I appreciate it. Any other questions from anybody? Any other comments, questions you want to share? Okay. Mariano, you can quit sharing your screen there, I think, and so I think that concludes today's sessions. And I just want to thank again, Mariano and Chris for their participation with Humana. I want to thank all of you for participating today and this week. We've had many of you that have been on every session this week. I like to think that's more because of the moderator than because of the payers that are participating. I'm joking. I see a lot of familiar names out there, so it's been good to be with you. But I want to thank you. We'll look forward to certainly hosting these in the future. And again, the presentations will be sent out to you. And I thank you for your support of the virtual payer forum this year, and also for your support of Georgia HFMA. And hope to see many of you here again real soon. Have a great weekend. And thanks again, Chris and Mariano, for your participation.
You're welcome.
Thank you.
Very nice meeting you.
I appreciate it. Have a great
Take care.
weekend.
Bye-bye.